The bill that I chose was Bill A3618, which requires hospitals to provide written educational information to parents with a baby born prematurely. My interest in this bill is because of my level 2 experience that I did over the summer with early intervention. The problem is premature birth rates have been on the rise since 2018. They continue to increase. And premature births are most prominent with young maternal age, single mothers that are pregnant, low socioeconomic status, and African American race. And as young maternal age has proven to increase and there's more teenage pregnancy, that is also causing an increase in the premature birth rate since they are at a higher risk. And it's proven that those at the highest risk are less likely to have proper education and the needed resources to care for a baby born prematurely. And this is causing premature babies to not get the support and services that they need early on because many parents aren't aware of the resources and supports out there. So Bill A3618 is sponsored by Eileen Gunther, who is Democratic Party Assemblywoman. And this bill would require hospitals to provide written educational information for babies that are born before 37 weeks. Some of this information could include possible complications that can arise, proper care and support, infectious disease awareness, since premature babies typically have a compromised immune system, being aware of how to care for that and prevent infections, and also community resources for both the child and the family. And this includes early intervention, which can be occupational therapy, speech therapy, physical therapy, and other services that are provided as the baby is from age 0 to 3. And this bill, if passed, would be a new section of the public health law. There has been other versions of this bill since 2009, and they continue to change what is under the education that's provided. And this current bill has been in committee since January 2019. If this bill was passed, it would become a New York State regulation that hospitals have to follow. More information on the bill can be found at the link below. So those involved, formal actors are those that are involved because of the positions that they hold. So this is New York State Government, New York State Assembly, sponsor Eileen Gunther, and New York State Assembly of Health. And then the informal actors are those that are impacted by this or choose to be a part of this. So that would be occupational therapists. More people would be aware of their services and they would have to implement these early intervention services. Hospitals and staff members, mothers and fathers, early interventions providers, so this can include physical therapy, speech therapy, and then also advocacy groups. There's a lot of petition groups out there already to support this bill and people that have personal experience that are very involved to try to get this bill passed. Intended outcomes if this bill was passed and became a regulation are overall for more parents to be educated on premature births. If more parents are educated on premature births, the baby will have better functional and developmental outcomes. Typically, it's proven that the earlier that the child gets services that they need, the better the outcomes are. There could also be less caregiver stress because if parents have the support and the resources and know who to go to, what to do, they could have less stress on that they might think they're not caring for their baby properly or where to go. But if they're given this information from the start, this could reduce that stress. And also an increased use of community resources such as early intervention services, because this will be a part of the education and more parents will know what these services are and reach out for them. So policy analysis, in order to break this bill down, it really starts with the rational comprehensive model. This means that individuals were concerned with this problem for lack of education for parents, so they tried to create a rational solution. They all come together and they think, what will address this issue and facilitate change best. So this is when the regulation was created to try to ensure everyone equal access to resources and supports and make sure that every parent is getting the information that they need. Some obstacles to implementation are limited public and political interest. So many people are not concerned with this unless it has impacted them and they have personal experience. Along with political interest, there's higher pressing needs out there that political parties are concerned with and trying to change, such as gun control or abortion, things that the public is interested in and that are very familiar on the news, and things that are trying to be changed, where this one isn't so much unless people have personally been affected by it. There's also a lack of funding already for hospitals, so in order to implement this, it would take some additional funding to provide the written education, whether it's in brochures or however it is printed up for the parents is going to require more funding, so this could be hard with the already limited funding that hospitals have. The last two bullet points are with my meeting with my legislator. He thought that there could be a potential for a lawsuit towards the hospitals if they neglect to provide this information, and it is a regulation, especially if something happens to the child later on. This could become a lawsuit against them. He also feels, because of personal experience, that parents are already getting adequate information, and sometimes this is true for the larger hospitals, but many times the smaller hospitals are not giving out as much information, and there's not consistency for what parents are getting. Also, even if this bill was passed, it's hard to ensure that parents will read the information. If they do read the information, that they will actually implement the information. A lot of times having a baby is already stressful enough, so they might not necessarily implement all the strategies that they're given. And it would also require hospital staff to take extra time to sit down and provide this information to the parents. So some actions that I want to take to overcome these obstacles are: I've created a petition to support the passing of the bill. Petition can be found at the link below. I've shared this on my personal Facebook page and KUCA College OT program page, and I've also am currently trying to get approval for a pediatric Facebook page to post this petition in there and get some physical therapists, occupational therapists, and other pediatric providers to support this bill. And I also hope to visit some larger and smaller hospitals to gather data on what they currently are providing and use this to advocate and show that there's that inconsistency between hospitals. And finally, I created a brochure that can be found at the link below that I also want to hand out to prenatal care centers, specifically in Syracuse, New York. There are many for low-income families, young mothers, and I hope this brochure shows them what can be done and a little bit about this bill, and including the petition for them to support this. So the impact on occupational therapy, overall it's going to increase the demand for OT early intervention providers. If parents are given this information that occupational therapy can be used, then more parents are going to know that it's out there and potentially reach out for these services. Many parents don't know what that is unless their pediatrician, or in this case the hospitals, would be giving the information, or if someone recommends it for them, they're not aware that it's out there. So this would show them that it's out there, and more people would be willing to go look for those providers in their area. However, this could potentially decrease the need for OT services later on in life, such as school age. If a child gets the help they need early on for proper development, they might not need as many services later on in their life. However, this is not the chance for every child. Every child's different, and this can vary, but for some, they might not need the services later on. And finally, I think it can increase the understanding of the role and significance of OT. Many people don't understand what OT does, but if more people are having education on these services and going and finding these services, then more people are going to be aware of what OT can do, especially for pediatrics.